Hello again and welcome back. My name is Tom Nelson. This is a continuation of the homeostasis video lesson series. This is part 10. We're going to talk about acidosis. Remember, when the carbohydrate intake is too low and the level of fat in the diet is too high, the body is going to enter a condition called acidosis, which means that the pH will drop below the normal set points of that 7.35. It's going to become more acidic. It occurs because the kidneys and the lungs can't keep the pH within the set point levels, which we again had given was 7.35 to 7.45. So there are two types of acidosis. There's metabolic acidosis and there's respiratory acidosis. The metabolic acidosis occurs when the kidneys cannot produce enough sodium bicarbonate to neutralize the elevated acidity level in the body. Or it can occur if the kidneys malfunction and they discharge too much sodium bicarbonate in the urine. Respiratory acidosis, on the other hand, occurs when the lungs can't properly eliminate enough of that carbon dioxide and do it properly, which results in a buildup of carbon dioxide in the bloodstream, so it's going to become more acidic. So under normal conditions, your kidneys and your liver can compensate for changes in the pH, but it's not a fast process. So when high acidic diet or other conditions prevail that will cause rapid severe changes in the pH, the liver and the kidneys are going to lose their ability to compensate. Asthma, chest injuries, obesity, breathing difficulties, overconsumption of alcohol or sedatives, muscle weakness in the chest, nervous system disorders, or deformed chest structure are common causes of respiratory acidosis. Symptoms of respiratory acidosis can vary quite widely, but the more common symptoms include fatigue, becoming tired very easily, confusion, shortness of breath, and sleepiness. Under normal conditions, your kidneys are going to discharge some of the excess acid into the urine while producing small amounts of sodium bicarbonate to try to neutralize the excess acid that remains. Some illnesses, especially those that cause diarrhea or vomiting, will result in acidosis. It's called hyperchloremic acidosis. If the lactic acid levels become elevated, which results from over-consuming alcohol, or heart failure, cancer, seizures, liver failure, or prolonged lack of oxygen, extreme exercise, or low blood sugar, metabolic acidosis will usually result. Diabetes can also cause metabolic acidosis as well. As stated, low blood sugar can cause it, but poor diabetic control, dehydration, which is obviously very common in diabetics, obesity, sedentary lifestyle, and poor insulin control will result in a metabolic acidosis. So too will insulin resistance. Some medications, including aspirin, can cause an increase in acidity. So the symptoms of metabolic acidosis are also numerous, but the most common symptoms include rapid or shallow breathing, confusion, fatigue, headache, sleepiness, lack of appetite, and a fruity smell in the breath. Elevated acidity, a low pH, is very stressful on the pancreas and also the liver and all of the other organs in the body. So the liver is singled out because it's an elevated risk level due to the lower pH levels. The liver plays a major role in removing acid waste from your body. So when the acidity levels rise too high, the liver's function is going to be impaired. The liver and the pancreas lose a large part of their capacity to regulate the blood sugar. pH is of particular importance in type 1 diabetics and insulin-dependent type 2 diabetics because their bodies do not produce enough insulin. Their cells metabolize fat reserves, which in turn produce beta hydroxybutyrate in the liver, and their pH level in their bloodstream can rapidly drop to very dangerous levels. So beta hydroxybutyrate, which is an acid, becomes an energy fuel source when the blood sugar is low. By definition, its production by the liver is primarily caused by acidosis. So type 2 diabetics typically have excessively low urine pH. So they are at significantly higher risk of developing nephrolithiasis, a kidney disorder. and developing kidney stones. So the urine pH of diabetics is typically below 5.5, which is more acidic. Normal urinary pH levels range, again, from 4.6 to 8.0 on the pH scale. So when the urinary pH drops, it becomes more acidic, acidosis will be present, and diabetic control will be poor. The blood sugar control will be lost. Dehydration is more likely to occur. Gout is more likely to develop. Urinary tract obstructions are likely to occur. Pyloric stenosis, urinary tract infections, kidney failure, and the formation of kidney and bladder stones are very highly likely. So you can test your urine by purchasing pH indicator strips at a drugstore and dip the strip into your urine and then compare it to a color chart on the package to determine what your pH urine level actually is. But it's going to be a reflection usually of your diet. Insulin resistance is a major cause of elevated acidity in the body. Insulin is degraded by acidity whenever the blood pH is below 3.5, insulin becomes degraded. And diabetes with lower pH levels are going to experience pain at their injection sites if the pH gets too low. As stated, obesity is a major contributor. Ethnicity also plays a major role. Hispanic, African, African Americans, American Indians are more prone to elevated pH levels, meaning being more acidic. In addition, high acid foods, especially sodas and colas, which again has a pH of 3.0, highly acidic, are major contributors to elevated pH and the associated consequences. In other words, too acidic. So when insulin levels are too low, the body releases fat from the fat cells into the bloodstream. Normally, insulin will stop the release of fat from the fat cells. So if the liver picks up those fatty acids and triglycerides when the blood sugar is low, and it produces ketones and keto acids, which are again going to lower the blood pH level. So the ketones and the keto acids serve as an emergency fuel source for your body's cells, and that usually occurs when you're insulin resistant. Diabetics have a slower colonic transition time, meaning the rate at which fecal matter moves through the intestines. So if they have fatty liver and fatty pancreas, depending on how much fat is located around the center of the body in the adipose and visceral tissue, it will cause an increase in acid production in the body and alkali loss. So a slower transition of matter in the intestines is going to lead to bacterial fermentation, which also increases acid production, just making things worse. So now go to part 11, how the hypothalamus manages glucose. Thank you for watching, and please pay it forward.